Atul Khadke from Taluka Ahmedpur, District Lapur. I am running my own setup, which is a 5 to 6 bedded ICU and 20 bedded normal beds. I have completed my MBBS from Terna Medical College, Navi Mumbai, and my post-graduation in medicine from the Rajiv Gandhi Medical College, Thane. After that, I have completed my post-graduation, that is a IDCCM, Diploma in Critical Care from the HN Reliance Hospital. After that, I am completed my fellowship in diabetes, fellowship in stroke from the HN Reliance same hospital. Also, I took one clinical course that is called Advanced Clinical Cardiology from the Apollo Hospital, Navi Mumbai, Belapur. Today's my topic is understanding hypertension. Our today's discussion will be on what is a high blood pressure and how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the vessel. This is called the blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when the blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than the normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of the unhealthy lifestyle choices. For example, not having enough regular physical activity, which is seen in the day-to-day activity, like person is obesity, smoking, alcohol consumption, and stress factor. There are other risk factors that can also increase the risk of developing hypertension, such as first is age. When the people gets older, the arteries can stiffen up and narrow up, excess fat buildup. Family history of the high blood pressure. One or more close family members with hypertension increases person's risk of developing the condition. Third is excess salt intake is also known to raise the blood pressure. Not eating enough food with the potassium can increase blood pressure and risk of stroke and chronic kidney diseases. Eating processed and fatty food increases fat throughout the body and make the heart work harder to push the blood through the body, hence causing the blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to the high blood pressure. Another one is a stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, the hypertension does not have any obvious signs and symptoms. That is why it's often called as silent killer. It puts people at the risk for several diseases, from cardiovascular problems to the kidney failure, stroke, and even the eye damage and the blindness. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether a person have high blood pressure or not. Generally, when the symptoms do occur, they include morning headache or tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting. If person is experiencing the same of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called as sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now, let's try and understand what do these numbers actually mean. A healthy or the normal blood pressure should be lower than 120/80, or it can also read as 120/80 mmHg. Here, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is or more than 140/90, then person have hypertension. If person have the BP level higher than this, then he or she might at risk of developing serious heart diseases. On the May 17th, we celebrate World Hypertension Day, a day dedicated to the highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year World Hypertension Day is measure your blood pressure, control it, live longer. Ensure that your BP is measured and controlled if it is elevated. These risks can be prevented and reduced by taking steps towards the healthier lifestyle, as regular exercise, healthy diet, quit smoking and alcohol intake, regular blood pressure monitoring, stress management, adherence to the medicine, and low salt intake. If blood pressure is peacefully controlled with such lifestyle modification, then it might avoid delay or reduce the need for medication. So let's take at these strategies one by one. First is the regular exercise or physical activity. Exercise can be drug-free approach to lowering the high blood pressure. Regular physical activity makes person heart stronger. If one has strong and healthy heart, it can pump more blood with less effort. So, if heart has to work less to pump, the force on the blood vessels will decreases and lower the blood pressure. In other case, as we all are aware that age and weight gain are the two major risk factors for the high BP. So, if blood pressure is at desirable level, that is less than 120 by 80, then exercise can help it prevent from rising as we age. Regular exercise also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 10 minutes of aerobic exercise most day of the week. High blood level can reduce doing regular structured exercise such as brisk walking, jogging, and swimming. Second is healthy diet. Diet also plays an important role in controlling blood pressure. A diet with a high intake of the vegetables, fruits, and whole grain is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as a DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of the potassium, limiting the amount of sodium in the diet and avoiding alcohol consumption. DASH stand for the dietary approach to stop hypertension. Diet. Eating a DASH diet that is rich in whole grain, fruits, vegetables, and low-fat dairy products and skims on saturated fat, cholesterol can lower one's blood pressure by up to 11 mmHg if having high blood pressure. Reduce sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce the blood pressure by about 5 to 6 mmHg. If you have high blood pressure, to decrease the sodium in your diet, you can consider tips like read food labels. If possible, choose low sodium alternative of the food and beverage you normally buy. Eat fewer processed foods. Only a small amount of the sodium occurs naturally in the food. Most sodium is added during the processing. So you can eat natural products. Don't add salt. Just 1 level teaspoon of the salt has 2,300 milligram of sodium. Avoid adding salt to the food. Use herbs or spices to add flavors to your food. Quit smoking. Stopping smoking helps your blood pressure returns to normal. Quitting smoking can effectively reduce your risk of heart diseases and improve your overall health. Regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for a patient to visit a doctor and check up their blood pressure. Hence, most often I advise patients self-monitoring of their BP level. Self-monitoring can help to measure the BP at different times throughout the day over the longer period of the time. It also assists doctor to get more complete picture of the person's blood pressure reading at a different time. Further helps us in a better prediction of the cardiovascular comorbidity and mortality rather than single routine blood pressure measure that occurs during clinic visit. Fifth one is the stress management. By learning how to relax, manage stress can improve emotional and physical health and lowers high blood pressure. Stress management technique include exercise, listening to the music, focusing on something calm or peaceful, and meditate. Adherence to the medicine. A medicine to the lower blood pressure may be recommended by doctor if your blood pressure is consistently high, usually at above 140 by 90. Adherence to the medicine is very important as it control your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help you and us to enjoy the long and healthy lifestyle. High blood pressure can prevent it as well as control it in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is much possible to maintain normal pressure levels with regular monitoring and preventing care. Thank you.